So today we've been asked to place a patient on fluids. This patient has been asked to be placed on fluids because he's had vomiting and diarrhea, poor little lad, which has meant he's become quite dehydrated. So we are replacing the fluids that he's lost with fluid that is sterile, making sure that he doesn't become dangerously dehydrated, that his blood pressure doesn't drop. There are multiple reasons that we might place a patient on fluid. One is if they've ingested a toxin, something that's particularly nasty and it's really dangerous for the kidneys, and we're just giving them a bit of a job to flush it out. One is if they've lost blood volume, so if they've had a serious injury or an internal bleed and they've lost blood that way, and we need to replace the blood they've lost, so that's things like blood transfusions. And one is if they're dangerously dehydrated. Again, usually this is because of vomiting or diarrhea, but we can often see it as well in cases where patients have been locked in cars, they've gotten too hot, they've overheated, or maybe they've not been able to eat or drink for a while because of a mouth injury. And the other one is if their blood pressure's dropped. So reasons for blood pressure dropping can be due to heart conditions, but also, and quite commonly, anaesthesia. So we'll talk about that more in the second assignment. So this poor little guy is going to have to go on fluids. So there's lots of things we need to collect first. Number one, we want our fluids. These are hung up here. These are ready prepared. These are all completely sterile. This is what we call Hartmann's. So if you look on the bag here, it tells you all the different things that it contains. So sodium chloride, potassium chloride, calcium, and various other electrolytes. So Hartmann's is, we say, the closest thing to the natural body plasma than we can actually get. Other examples include saline, you can have whole blood, you could have frozen plasma, but for this job, Hartmann's is probably going to be the best because again, we're wanting to give the patient a drink, for want of a better word. So in here are our fluids. Now, even though this is majority just water with some electrolytes in it, this is a prescribed veterinary medicine, so only veterinary surgeons can prescribe fluids under Schedule 3 of the Veterinary Surgeons Act. So already attached, I've already done this for us, but this is what we call a giving set. Now this is what delivers the fluid from the inside of that sterile bag to the patient. Inside this giving set again is completely sterile, and you can see there is a small outlet here that allows the fluid through. So this is all clamped off at the moment. You can see all the rollers are clamped down. The clamp is shut as well, so nothing is coming out at the present. But when we attach it to the patient's cannula, it will deliver directly into the vein. One thing we must always check with these is that there are no air bubbles, because we do not want to give a patient an air embolism. That is something that is life-threatening and incredibly dangerous. So just looking at this giving set, this would not be suitable for use. I can already see some really nasty big air bubbles here, just next to my finger. We usually say anything over 0.5 centimetre is too big to go through. Right at the end, there's one that's a good couple of inches. So that is not suitable for use. I would have to run that through, make sure there were no air bubbles in there before I attach that to the patient. Otherwise, I'd risk something really serious. Really, we don't want to waste fluid as much as we can, but more serious is putting air into a patient. So I've got my little friend. He's feeling very sorry for himself. I will need someone to help restrain him whilst I place his IV cannula. But this is the equipment that I will need. So I have here some clippers. These clippers are to remove the hair on the leg. Some clients get really funny about removing hair on their patients, but it is actually, hair is a gross contaminant, which means it contains lots of bacteria. So if we don't remove it, we are way more at risk of causing a vein inflammation or infection. So I've got my clippers there. I have a swab with some surgical spirit and a antiseptic, so we would use chlorhexidine gluconate or Hibby scrub, and we would use this on a swab and we would clean the area for 30 seconds. Surgical spirit is to, or isopropyl alcohol is to remove any grease on the surface of the skin, and the antiseptic is to remove any surface level bacteria. Obviously, because I'm going into a vein, this is something that is, if I have anything on my hands, if I have any source of infection, I'm putting it directly into the patient's vein and it can travel anywhere around the body. So gloves are a must. I'm also going to wash my hands before I handle my patient. Here I have my cannulas. So these are what is actually going to sit in the patient's leg. And I've got two sizes. So you can see in here, there is a white, we call it, that's the cannula, and then there's a sharp pointy bit of metal coming back, and we call that a bevel. So that sharp piece of metal will puncture the skin and cut through into the vein, and then when we're comfortable that we're in the vein, we'll remove that sharp piece of metal and slide the plastic tube into the vein and attach the fluids in a sterile manner so that they can flow into the vein. It's really important that we choose the right size cannula. So cannulas can come in many sizes. If you have a cannula that's too small, it's likely to just block. If you have a cannula that's too big, it's likely to scrape the inside of the vein, which is really painful. And we don't want to do that. We don't want to cause discomfort to the patient. You can, in some extreme cases or in referral hospitals, place a cannula directly into an artery, but that is a much more complex procedure because arteries have greater pressure and they will be forcefully trying to push the cannula out, where veins are under a lot less pressure, so they will hold a cannula quite comfortably. Reasons you place a cannula directly into an artery is if you wanted to get repeated blood samples and measure oxygen saturation, or if a patient was really poorly and you needed to constantly be measuring their mean arterial blood pressure. It's usually something that's done in referral hospitals. It's not something we tend to do on the daily in a first opinion veterinary practice. So we'd have a selection of cannulas. It's not something that is necessary, but I would always recommend get at least 2 cannulas. Just in case you miss with the first one, you don't have to run about and try and get a second. So I'm also going to get some dressing. I'm going to just place that directly on top of my cannula to keep it as clean as possible. And then I have some tape here. So this is surgical tape. This is just the same paper tape that you get at the hospital when you get a blood test to hold it in place. And then I'm going to bandage it in place as well. So there are 2 things that I don't have here. One is a bung. So you can see on the end of this cannula there is a little piece of plastic that comes off quite readily. And if we were just placing a cannula, we would use a bung. And the other thing is something called a T-connector. So a T-connector is a really useful piece of equipment. They're not necessary to put patients on fluids, but they make our lives as nurses and VCAs significantly easier. A T-connector will sit between this section here, which is the sterile section that enters the cannula, and the cannula itself. So it's a bit of a middle ground, that T-connector, and it means that we can disconnect patients from fluids a lot more readily. So if we need to take them out for a wee, or we need to get them in to do some sort of procedure, or we just want to get them out of their kennels and give them a thorough assessment, we can do that without having to touch around this particular part of the cannula and this particular part of the cannula, which are really close to the patient's vein, and that means it's a lot less likely that we're going to give the patient an infection.